You know, your own body might be sending you secret signals about your kidney health right at this very moment. We're talking about clues that are hiding in plain sight, clues that could tell you something's wrong way before it gets serious. And this is exactly why you've got to pay attention. I mean, look at this number. Up to 90%, that's 9 out of 10 people with chronic kidney disease have no idea they even have it. That is just, it's a staggering statistic. It's this huge problem just hiding right under the surface. So, what are these secret signs? Well, I want you to think of this as kind of like a detective story. Together, we're going to uncover the clues your body is leaving behind, piece by piece, and solve the mystery of what your kidneys are trying to tell you. Okay, let's start the investigation. So, here's our roadmap. First, we'll look at the kidney's secret job. Then, we'll hunt for clues in the bathroom. After that, we'll see what your body shows on the outside, uncover those invisible signs happening internally, and then finally, we'll talk about how you can take charge of your own health. All right, first up, we need to understand what we're dealing with. See, most of us think of kidneys as just simple filters, right? But they are so much more than that. They're these incredibly sophisticated organs with a ton of responsibilities that go way, way beyond just cleaning your blood. I mean, just look at this list. It gives you an idea of the sheer range of tasks these things handle. They're regulating your salts and potassium, they're balancing acid levels, they control your red blood cells, they keep your bones healthy, all while filtering out toxins. They really are the ultimate multitasking managers for your body. Okay, so our investigation is going to begin in the most accessible place there is, the bathroom. This is where some of the earliest and honestly most telling pieces of evidence can show up. So, have you ever noticed a really persistent, thick layer of foam in your urine? Kind of like the head on a beer that just won't go away? Well, that's not normal. It's often caused by a protein called albumin that's escaping from your blood. See, healthy kidneys have this amazing filter that's supposed to keep albumin in your blood. So, seeing that foam is a major red flag that the filter might be leaky. And hey, let's just bust a common myth right now. A lot of people think, oh, I pee a lot. My kidneys must be super healthy. But the truth is, it's about quality, not quantity. One of the very first things to go when kidneys start to struggle is their ability to concentrate urine. So if you're finding you have to get up multiple times every single night, that could actually be an early signal that something's up. All right, so we've checked the bathroom for clues. Now let's expand our investigation and look for visible proof that you can find right on your own body. Okay, you can actually do this next test with me right now. Just roll up your pant leg and gently press your thumb into your lower shin. Hold it there for about 5 seconds. Okay, now pull it away. Did it leave a little dent, an indent that stays for a bit? If it did, that's something called pitting edema. It's swelling. And this is all part of a chain reaction. Remember that albumin protein we talked about leaking into your urine? Well, its job in the blood is to act like a sponge, holding fluid inside your blood vessels. When your albumin levels drop, those vessels get leaky and fluid escapes into your tissues. Gravity pulls it down to your legs and feet, but you might even see some puffiness around your eyes in the morning. It's a real vicious cycle. Now, for a really specific clue, take a look at your fingernails. You're looking for something called half and half nails. Check it out. The bottom half of the nail bed is white, but the top half is this distinct reddish-brown color. It's totally different from that normal little white moon you see at the base of your nail, and it has a very clear association with chronic kidney disease. So we've gathered all this external evidence. Now we're going to go deeper. Let's uncover the inside job, these complex, invisible chain reactions that are happening inside your body when your kidneys are in trouble. So a lot of the time, it starts with a mineral called phosphate. We get plenty of it in our diet, and healthy kidneys, they have no problem getting rid of the excess. But damaged kidneys, they can't. So phosphate builds up in the blood where it grabs onto calcium, and together they form these hard, sharp little crystals. And believe me, these crystals can cause a whole lot of problems. When those crystals start depositing in your arteries, the results are just shocking. The walls of your arteries, which are supposed to be soft and stretchy, can become as hard as bone. The doctor in our source material described it perfectly. He said when you press on the skin over the artery, it feels sort of like a guitar string underneath the skin. Just imagine that. Now, as kidney function goes down, a whole cocktail of other toxins starts to build up in your blood. The condition is called uremia, which, is really just a clinical way of saying urine in the blood. And this toxic sludge is the root cause of so many of these weird and subtle symptoms. And uremia can cause a whole mess of signs. We're talking about a relentless, maddening, all over your body itch. We're talking about that horrible urge to move your legs at night, known as restless leg syndrome. It could be a persistent metallic taste in your mouth, like you're licking a penny, or even things like loss of appetite and bruising really easily. Do you ever just feel completely wiped out? I mean, just bone tired for no good reason? Well, that could be a sign too. Kidneys produce a hormone called EPO, which is the signal that tells your body to make red blood cells. Yep, that's the same EPO that some professional cyclists famously use to boost their performance. So if high levels can help you win a bike race, you can only imagine how low levels from failing kidneys can make just climbing a flight of stairs feel absolutely impossible. So, we've reviewed all the evidence. We've seen the clues. Now it's time for the final verdict. How you can take all this knowledge and actually use it to protect yourself and take charge of your health. And honestly, here's the kicker. This is the single most important takeaway. For so many people, all these symptoms we just talked about, they don't even show up until they've already reached stage 3 of a 5-stage disease. It is a truly silent condition in its early phases, which is why being aware of these subtle clues is everything. But here's the good news. We know who the most common culprits are, and this is where you can be proactive. The biggest drivers are diabetes and high blood pressure, two conditions that are often preventable or at least manageable. And it is so crucial to be aware of another growing cause, the chronic overuse of common over-the-counter pain relievers, specifically NSAIDs like ibuprofen. Which really just leaves us with one final crucial question. Now that you know what to look for, what to feel for, what to notice, are you listening to your body's clues?